past 8 o'clock. We're late. I told Miss Penny that we started at 8 o'clock, and we normally do, or a minute till. I want to thank y'all for being here, considering it's kind of chilly. And I'd ask the senator to please sit down. He's disturbing my meeting. Thank you, sir. He had a bill on, for the proper term there was had. I'm going to ask Vice Chairman Lumsden if he'd open us with prayer, please.
You would please join me. Our dear Heavenly Father, we thank you for this day. We thank you for your love and your goodness to us, for watching over us and caring for us. And thank you for all the many blessings you sent our way. We pray, Lord, we just thank you for the opportunity that you've given to us to be of service for this state. And we just thank you for where you've placed us. We just ask, Lord, for your wisdom and your guidance and your direction so that we might do that which is good and right and beneficial for the state and for the people of this great state and in your sight. We pray these things in Jesus' name and for his sake. Amen.
Amen. Thank you, sir. Okay. I told Miss Penny that we would do Senate Bill 206 first. So, Mr. Martin. And by the way, folks, he got here about 6:45 this morning because he was walking out of the parking deck at that time. So, early riser.
No, he hadn't changed his spot.
We'll see. We'll see. We've already got questions being proposed over here. Who's 27? Okay, well, I'm going to turn you off and then you can punch it back in. Okay.
Thank you, Mr. Chairman. Committee, I really am very appreciative of the opportunity to present SB 206 this morning. And I'm very appreciative of the chairman for his willingness to work on this issue. So I just really want to say that, and I can't express that enough. So I'll get really quickly into this. Basically, the bill, it requires small group health insurance policies to cover hearing aids for children 18 years and younger who have or have been born with hearing loss. These children without early intervention will face great difficulty in life, and delaying this intervention, even just for a couple of years, they can really face difficulties in speech and in literacy over their lifetime. So I think early intervention is very important. Because here's the deal, when they actually have hearing aids, when they're born, they can be fitted up to 3 weeks old. And when they do that, they're able to hear the very same sounds that you and I can hear. I have a good friend, and he can't be here this morning. Many of you guys probably met him last week. His name is Jack McConnell, and he was the reason that I was convinced to carry this piece of legislation. And the reason is he is that normal child. He grew up as a normal child. He was the first child that was diagnosed with hearing loss in the state of Georgia under our American mandatory newborn screening. And his parents were able to afford to get him hearing aids, so he grew up as that normal child. He plays lacrosse. He has a 4.0 GPA, and he's even started a foundation that helps other children who can't afford hearing aids to be able to get those. The funniest thing about him when you talk to him is he likes to talk about how he's normal. Now, I don't see Jack as normal. When I see him, I see an exceptional young man who's actually changing the world around him. But that's what he likes to focus back on, is he is a normal guy. This legislation will basically allow other children in Georgia to have the same hearing aids that he had, the ones that can't afford it, and have that same opportunity to be normal. But in that normality, they will be able to affect the world just as Jack has, I hope. It at least gives them the opportunity to do that. Quickly, I'll talk about the cost. That's the reason I carried it. Here's some good information about the bill. This will save the state and it will save our school districts a lot of money. The average IEP costs an additional $420,000 for a school district over the educational life of that child. It's also estimated that it will cost the state, for a child with hearing loss without early intervention, it will cost them approximately $1 million over the lifetime of that individual. The good news is like I said earlier, these hearing aids can be fitted at 3 months, 3 weeks old, as early as 3 weeks old. These children grow up hearing the voices of their mothers and their fathers. They grow up hearing the same noises. There's even a story of talking about early, when you can't hear as a child, when you clap your hands. They have difficulty, if they don't have early intervention, maybe locating what that is or what that even means. And so this allows them, like I said, to have that normal life. So it's very important. The other good news is this, is it only costs approximately 2 to 3 cents per month per insured person additional for insurance policyholders. And that's an estimate. Of course, in the instance where a hearing aid prevents the necessity of a cochlear implant, this actually will save money to the insurance companies. The cost of that is estimated around $200,000, and the lifetime benefit for this is about $42,000 for a child with hearing aids. In the same way, I know there still were some costs, some concerns about the cost of this for insurance companies and policyholders. So we put the same controls we put in the autism bill that we covered a few years ago. For small businesses, it will only apply to businesses that have 11 or more employees. And we also put the same control in there. If it is shown that it will increase premiums more than 1%, then an insurer who can show that will be exempt from this provision. I remember as a father distinctly when my Charlotte, my oldest was born, I remember sitting in there and the nurse came in and said, "Hey, we're here for a hearing screening." I didn't know this existed. I remember specifically during that time, just that little brief moment of fear saying, "Hey, what if my daughter can't hear me?" Now, obviously she can. There are going to be children all over the state this year where they're not going to have that same outcome. And I believe this legislation goes a long ways and will help them to make sure that their children can live that normal life and hopefully grow up and affect the world in the same way that Jack has, in the same way hopefully that you and I have. And I will yield for any questions, and I ask for your favorable consideration.
Thank you, Senator. I think it's important that I make a few comments on this because I've been saying no to this piece of legislation now, I guess, probably 6 years, 5 years. Because I don't know of anybody who dislikes mandates more than I do. But I think in this particular case, this piece of legislation time has come. I want to give you some information here. With Peach Care and Medicaid, we have 1.3 million kids in that program here in Georgia. And of those 1.3 million, only 503 required hearing aids. Now, Senator Martin mentioned that when his daughter was being tested, that that moment of not knowing if she could hear or not, or would require hearing aids, he was fortunate. But what about that parent now who they say, well, your child has a hearing disability, go on home. Nothing we can do to help you. And hopefully that's what this piece of legislation will stop, that there will be help for those. Now we have to realize this does not impact ERISA plans. The only plans it impacts are those who are term fully insured or have an individual policy. So it's very, in the big scheme of things, it's a very small group of people in the state of Georgia. Because remember, 1.3 million kids are on Medicare or Peach Care already, and they get coverage. Your ERISA plans, we can't do anything with them, so it's 75% of those of Georgians who have insurance fall in that category. So, we're looking at a refined group, but I think like I said, its time has come that we need to do something. All right. I don't remember who pushed their button first, but I'm going to give 17 their first one.
Thank you, Mr. Chairman. And thank you to the author of the bill for this important piece. My question concerns putting in the dollar amount of $3,000 in the bill, because at some point that's not going to be adequate, and we'll have to revisit that. So can you talk to me about why you would put it in the bill at that level?
I mean, I think that the reason we put that in there, it comes from, that's the benefit that's in the state health benefit plan. And so we're matching that same benefit. The state health benefit plan started at a much lower number, and Medicaid started at a much lower number, and they found that the estimated cost that they paid out was much less than they had estimated. So they increased it, and they increased it again to $3,000. It's estimated that will cover the cost of the hearing. That's the other part of it. So it's a per year. So it's it should cover. I believe the cost for a children's hearing aid is between $2,500 and $3,000, and so it should cover those costs, and that's why it was put in there.
My only concern is that 5 years from now or 10 years from now, that might not be a good number. And I guess we'll have to come back at that time.
We would. I mean, it's also it's another one of those things to try to help alleviate the cost of small business on these. Anytime we're dealing with mandates, we want to be very sensitive to that. So we wanted to make sure that there was a limiting factor to give some assurance to the business community.
Thank you.
Thank you. Number 12.
Thank you, Senator Martin, for bringing this bill. And you mentioned $42,000, so from birth to or diagnosis or fitting with a hearing aid until 18, you're looking at 7 pairs of hearing aids, $42,000, $6,000.
That's the estimate. It's every 4 years is the allowance of the change.
An infant could wear.
I was given 42. When I do the math, it actually comes up to a little less. But I guess there's some possibility for some additional.
Both of these would be 6,000, so 7 would be 42. So an infant or a 6-month-old could wear that hearing aid until they were 4 years old.
I believe so. 'Cause I think the way and they have a fitting that goes to that hearing aid. That
I understand. Again, thank you for bringing this bill.
27.
Thank you, Mr. Chairman. First off, I noticed in the crowd former Representative Ed Lindsay, and I would like to acknowledge him because he began this effort several years ago with the bill. And as we were working on House Bill 228 and SB 206, reached out to former Representative Ed Lindsay to give me some historical context on that. And also to that, Jack McConnell can't be here today. He is the exceptional young man. And we actually had a privileged resolution last year to speak to us in the morning. And he talked about mandates. And to be honest with you, at that time I cringed. I says, Jack, don't say that, because mandates are a bad word in this side of the house. But we've worked through that on the issues. But what was really neat is after he spoke, he got to speak to Representative Chair Lady Penny Houston. And she's been working tirelessly on doing something for the hearing impaired in the state of Georgia, probably 20 years or so. And it's just so heartwarming to see her efforts. So, Mr. Chairman, this bill has my complete support, obviously, along with my 11 co-signers when we had a companion bill in the House. And I'm sure that it'll be very popular and will gain wide support. Thank you for bringing the bill.
Thank you, sir. Number 20.
PK, thank you for bringing this. This is, I'm sure it's going to change a lot of kids' lives. My question was more on a technical side on lines 106 and 107 on the bill on the 4th page. It's where it basically says this is going to impact private insurance plans for group coverage for 10 or more employees. Just if you could just talk, would not impact 10 or fewer. Well, okay. Why was 10 selected, and are we talking about full-time employees? Is that, or do we need to make sure that's clear in the bill, or can you just talk about that clause?
I mean, this is taken directly from the autism bill. It's the exact same wording that we used in there. And we'd use that to help, again, reduce the impact on small business, the impact on small business.
Sure.
It was in response to the Mandate Commission, in this work before the Mandate Commission. And, to me, it seems like it's okay, because it's been okay with with autism coverage the past 2 years ago.
Mhm.
So that's why I'm comfortable with it, so.
There's not been any consternation about that language in the autism bill? Okay. Thank you, Mr. Chairman.
24.
Thank you, Mr. Chairman. Senator Martin, just another sort of technical question, lines 50 through 54. It says that in the event that a hearing aid or aids cannot adequately meet the needs of the covered individual, and the hearing aid or aids cannot be adequately repaired or adjusted, the hearing aid or aids shall be replaced. Does that happen very often?
I would have to speak, that the advocates can speak to that more better than I can. I understand that's more of a warranty issue when, you know, when it doesn't, when you have that specific hearing aid that just can't, it's not working for the child.
And it makes sense, but there doesn't seem to be any limit, dollar limit, or if it is a warranty issue, is that something that would be covered in the initial 3,000? It doesn't, it's sort of vague on
I
that.
can move back. I believe they come with 4-year warranty for the most part, 3 to 4. So they already come with that 3 to 4 year warranty. I believe this is just.
Well, again, to follow up question then, if it's covered under warranty, it appears to leave it rather vague and sort of open to the interpretation that you would have to, the insurer would have to pay up to another 3,000. In that case, didn't seem to be a time limit or a dollar limit in the scenario such as that. But that's just, if it's covered by the warranty, I guess my question is, what's the need for those 4 lines, 5 lines?
I mean, to me, it's a matter of clarity. Just to make sure that the hearing aid's gonna work.
Did the floor leader do that? Mr. Williamson, you've, yes.
Again, just following up, I'm being dogmatic about it, I understand, but it seems like if it's covered by the warranty, it ought to be covered by the warranty and not leave this vagueness that it might be going open for misinterpretation, going back and forth. I'm not worried. I'm worried about the children, but I would hate to see a provider just sort of milk a situation and get more money and say, well, that didn't quite fit right, or it just seems like it's open for mischief. Is that not true?
And we can, I mean, I'm willing to, I know there's an amendment to add the effective date on this bill. If there's something we can do, well, there'll have to be an agreed in the Senate. If there's something we can do just to tighten that up for you between now and.
I'd appreciate it.
Continue to work with you on that if there is concern, if that's causing a problem.
I'd welcome that opportunity. Thank you.
Thank you, sir. Number 11.
Thank you, Mr. Chairman. Thank you, Senator, for bringing the bill. Could you speak to on line 43, talk about the age of 18? I know we've been discussing this idea as long as I've been here, and I have in my mind that it's aimed at if we can help these children at young ages develop, be able to hear, it can help them develop more naturally. Can you speak to why we chose the age 18 for why it would be covered up through age 18?
I guess you have to, at the end of the day, you have to choose it. I mean, if you're talking children, I mean, that's what this is, again, like you said. I mean, you said in your question, we're talking about helping young children as they're developing, as they're coming, so that they can have every opportunity that other children have. And I believe that, to me, 18 is kind of that understood, I guess, socially accepted enough age to speak to being a child to becoming an adult, I guess. And really no particular reason other than that 18 was chosen, I guess.
Doesn't it mirror the state health benefit plan also?
Okay.
Okay. All right. Don't see any more questions. I guess it's time now for number 20.
Thank you, Mr. Chairman. Senator, again, thank you for doing this and bringing this bill. I had one question, and I asked this in a lot of insurance meetings and Ways and Means meetings. I just want to make sure we're competitive when we're making these kind of requirements and so forth. Do you know how many other states have this some sort of requirement like this? Maybe not with this specifics, but how many?
20 other states.
20 states, and how many of those are border states to Georgia?
I believe it's Tennessee and North Carolina, if I'm not mistaken.
I think
Okay.
you're right.
Yeah, I think so. So,
I think you're right.
well, Mr. Chairman, at the appropriate time, I'd like to make a motion. Do
Appropriate
pass.
times now.
Do pass.
All right, second. All in favor, say aye. Aye. All right. I had enough yeses.
We had an amendment, though, right?
Oh, yes. One second. We're gonna have to rescind your amendment, your motion, and we're gonna have to pass this amendment. And all the amendment does is change it from July 1st effective date to January the 1st effective date of 18 in order to allow the insurance community to get everything in place. So I need a motion on the amendment.
Move do pass, Mr.
All
Chairman.
right, now we have a do pass. All in favor, say aye. All opposed, like sign. All right, House Bill 206 as amended. Ready for a motion?
Move do pass, Mr. Chairman.
I got a motion and a second. All in favor, say aye.
Aye.
All opposed, like sign. Thank you.
Thank you, Mr. Chairman. Thank you, committee.
One suggestion. As soon as you leave here, go to rules, fill out the form, and be ready to stand on the wall. The rules chairman has a requirement of 3 days standing. Time's running short. We had a bill passed Wednesday of last week. It didn't get signed up on rules until yesterday. That really delays things.
It'll be dropped off as soon as I can get from here to my office to grab the form that's already been completed to get up to.
Very good.
Good answer.
Senator Huffstadler, did you hear that, those remarks? Very good. Thank you, sir. I know, he understands. He's already been there. Senator Huffstadler. This is Senate Bill 200.
Thank you, Mr. Chairman and committee. This bill, which has, of course, been through the Insurance Committee in the Senate and through our body and through your subcommittee chaired by Representative Taylor, is a permissive bill, but what it does, it allows the synchronization of medicines onto a 30-day cycle by a pharmacist. We've got a lot of people that have multiple medications. I'm very fortunate not to have any, but I know many people that have 8,
Just
9.
wait, your age is coming.
It's coming, I'm sure. A dozen medicines, and this allows them to all be synchronized on the same schedule. A pharmacist doesn't have to do it, but they are allowed to do it. Adherence to medications is a major problem in this country. The estimates, I guess if I took the median of what they think they are, would be about $108 billion. 17 states have already done this. An additional state didn't actually have to pass a law. They were able to do it by regulation. And it is here for your consideration. Be glad to answer any questions.
In regard to this, I talked to my pharmacist, and her comment was, in some cases we do it already, if the patient asks for it, but she said some cases we're not allowed to. And in her particular case, she said, we have patients who drive 25 and 30 miles to come here to get prescriptions, and they don't really like driving here once a week in some cases to get their prescriptions. She was very much in favor of this particular piece of legislation, but it, like you said, it is a permissive piece of legislation. It allows them to do it if they want to, but they don't have to. Am I correct?
Correct, and it does save a lot of travel time, but I think particularly with some of the elderly, it saves a lot of confusion. They know what's coming up, and they're not every week trying to figure out what they've got to do, and then they're taking their medications more regularly. The research has shown from other states.
Got a question from number 19?
Morning.
Good morning.
This is a good bill, and I appreciate you doing this. And I'm not going to ask you to amend this bill because I don't want to slow you down. We're getting too far into the session here. But, you know, repeatedly I see bills that address pharmacy supplies, medications, and things, and say 30-day supply. I hope in the future we'll say a month supply. There's only 4 months with 30 days. And really, I mean, if you think about it, you know, by the letter of the law, they're only getting 30-day supply, and it just doesn't make sense. But anyway, thank you for the bill.
I
Great bill.
appreciate your comments. Thank you, Representative.
All right, number 12.
Thank you, Senator. We, your words were right on, and this is a bill that's very important to me. My mother takes some 26 prescriptions, and when she was able to go to the pharmacist, it's only about 2 miles away, but she enjoyed that. But now that she doesn't drive anymore, we don't. And now this is really, I mean, and you said about the confusion. If their medicine's not there on time and they don't have that extra and know when you're going to bring it, a call every day, don't forget to get my medicine. This is very, very important, and I really appreciate you bringing it. Plus, we're always looking for fuel savings, and there are people who don't live a mile from the, and I tell you, this is one of the most important things I've seen since I've been here, and it's just a very simple bill. Thank you, sir.
I appreciate that, and again, this isn't an idea I came up with. It's been done in other states and been done successfully, and I'm just trying to pattern after what they did.
Okay, I don't see any more questions. I guess it's time for, it's appropriate. Got it. All in favor say aye. Aye. All opposed, like sign. Thank y'all. We will probably be meeting again, maybe Tuesday of next week. We're off that day, but we may be meeting that day for a couple of bills. But Senator, don't forget, go by and see Chairman Meadows and get your paperwork done. Yeah, I know you know the procedure.
I'm Chairman Meadows Senator, and
I know.
I'm the senator, except in Gordon County, where he's from. He claims he's a senator there. So
Well, I understand that too. Thank you, sir. Yeah. Yes. Who's your house sponsor?
Oh, I'm sorry. It's Representative Taylor.
Taylor. Okay. Very good. Thank you. Y'all have a good day. Number 13. No. I won't do that to you on an off day.
2:30 in the afternoon, right, Mr. Chairman?